NMIT. This is a revision video for you on how to incorporate some passive stretches into your relaxation massage. The things that I'll be noting through your exam will be your safety, the client's safety during stretches, and correct draping, as well as doing the stretches appropriately. So I'm not doing a massage, I'm just giving you a quick revision on some of the stretches that we went through. Remember that we started by doing a relaxation massage on the legs, and when you would finish massaging the legs, stretch the gastrocnemius, which needs the knees straight, just by turning the foot forward, which you can do with your hand, or you can put your knee and just use your leg to stretch the gastrocnemius. Remember to hold each passive stretch for 30 seconds and to repeat 3 times. Then the soleus with a bent knee. Again, just tipping the foot down, and if you can use your forearm and just lean your weight into it, it's very relaxing for you as well. Now from this position we can stretch the quadriceps. So once you push the foot towards the gluteals, get your end feel, you're stretching 3 of the quadriceps now, and then to engage the 4th, we need to actually bend this hip. So just pop your hand under the knee and lift. Now if their whole pelvis is coming off and you don't think that you're actually engaging those quadriceps, what you can do is you can lean across this leg, use your other hand under here, and hold the pelvis down with your other hand as you lift. Whatever works for you. You might find it better to put your shoulder in here and put your hand across. Holding for 30 seconds, repeating 3 times. Then you would repeat it on the other leg. You would come up, give your patient a back massage and gluteals. At the end of that, while they're still on their back, if you like, you can do a stretch on their thoracic. Remember with this, whenever we're around the rib cage, we use their breath as well. So get him to breathe in, and as he breathes out, stretch. Make a little lump in your towel where the spine is so that you know your hands are going to be either side of the spine and not on the spine. Breathe in, breathe out, and just twist with your hands as you lean your weight in. Gently holding the twist at the end. No forceful or sharp movements, or you might accidentally do a correction. When you've finished your back massage, we do the lumbar rolls. For you to see the leg position properly, I'm going to get him to sit up the other end of the table. Your patient, you wouldn't do that to, of course. So, Phil, if you can turn up to the other side of the table so I can show them the leg position. And face me. So, bottom leg straight or a little bit bent, top leg bent right over with the foot curled in behind. With your draping, it's really important to cover all this area, but if you want to leave the legs free so that you can move them around, then that's just common sense. Bring his arm back, his shoulder back, and move the shoulder back into a position where he rotates back, and then hold it there. I use my forearm. You might like to use your hand, whatever fits your body best. Then either using your hand or your forearm across the top of the hip and the gluteals, all the movement comes from here. The shoulder hand just fixes and the gluteal hand does the movement. So stretch, hold for 30 seconds. Then to intensify this stretch, you ask them to just let their leg fall off the table and repeat. Just fix the shoulder, all the movement comes with the hip. Now on some patients you may want to include an intensive hamstring stretch in this. If you feel comfortable doing it, you can hook your leg across and pull their leg up. And this is the third stage. And pull their hip down towards you. Roll back. Then you would do the other side. Of course you would do the other side. If you'd like to now, you can do a hamstring stretch. Really important that you drape really well when you're doing the front hamstrings from the front like this, because it can be very uncomfortable for them otherwise. So legs straight up, holding, look for the end feel and hold for 3 minutes. If you've got a big man with a heavy leg, you may need to climb up onto the table. Rest your hand either on their hip or their quadricep to help fix the pelvis on the other side. And then you release it and you repeat 3 times on each side, holding for 30 seconds. So from here, we'll do the front of the legs and give them a good massage, and the feet. If you've forgotten to stretch the calves when you're at the back, don't panic. You can easily do them from the front here. Then in your relaxation massage, you move up to the chest and the arms. Massage, you do a chest and arms person, and when you're finished that massage, stretch the forearm flexors and extensors. Some people this may be a stretch, most people it won't. Most people you will need to put their elbows straight, bend their hand back, turn it just a little bit, and you'll get a lovely stretch along here. Then hand back up. So you can either put your hand like this, or you can actually interlock fingers to stretch the flexors. Now for stretching the pecs, remember we need to do 2 positions. So the sternal head of the pecs comes out straight to the side for the stretch. If you're going to brace, brace on the opposite shoulder. And then the clavicular head comes up at an angle at about 10 o'clock. Hold each one for 30 seconds. And repeat 3 times. If you feel like you need more of a stretch, you can ask them to put their other hand out and give you a little bit of extra stretch across the chest. Then you come up, do your neck massage, face, scalp, however you want to organise this. And I know these are the tricky ones for you guys, and they're not easy to film. But remember that we were stretching, we were doing a side stretch, both sides, turning the head at an angle, and going up across the nipple line. So the ear is coming across the nipple in that direction and onto the other side. Now I'm happy with you if you just want to do that. I've also shown you, and if you're comfortable doing it, how to do this using your hand to brace on the other side and your own body to create weight into the stretch to make it more intensive. So if you feel like trying that, that's fine too. I'll just show you that side, and with this side you can do exactly the same movement, but you're coming up. If you're not comfortable doing that yet, just use your hands. And then crossing your hands behind, your arms behind, your hands on each shoulder, and then just stand up. And then always finish with some traction. So you hold on like this, behind on the occiput, resting your hand on the forehead, and then just lean back. Now remember, this is greatly assisted by them breathing in. So if they breathe in as you lean back, and breathe out as you go forward. Breathe in, breathe out. Because as the first and second ribs lift up, it assists the traction on the cervical vertebrae. Okay, hope that's useful. Good luck.